The recording, along with the closed captioning, which I hope is here to start in a couple minutes, will be disseminated after the webinar, along with the presentation and all the materials. You can also find those in the closing window, which will be in the lower left-hand corner at the end of the webinar. You can download those straight from that pod. Feel free to do so, but again, we'll send everything out to the mailing list. And I will turn it over to our fair leader, David Mitchell, to get us started and introduce our speakers for today.
Jessica, thank you very much. Jessica and I haven't really talked about this, but it's probably appropriate that we kick off our 2017 Employment First Community of Practice calls on Valentine's Day. So happy Valentine's Day. We're committed to spreading the love here today with our community of practice. We have two great speakers today with Mistie Johnson and Brian Dennis. Mistie is with the Work Incentives Planning and Assistance Program, and Brian with Iowa Workforce and the Disability Employment Initiative. Brian's actually going to carry double duties this year, as we have him coming back in April to talk a little bit more about workforce services. As we talked about the community of practice, we have a full schedule of events that are primarily on the second Tuesday of the month. An exception of that is next month on March 16th, so that's a little different. And then in August, we have two programs scheduled in the month of August. So check out that schedule and make sure you get those dates on your calendar, because I think it'll be a good series that will focus on multitude of topics that will help Iowa move forward. Besides the community of practice calls in Iowa, we are also doing a project with the South Central Behavioral Health Region, which is down in South Central, Southeast Iowa. We're doing some things to look at how we help the region as a whole move competitive integrated employment forward, specifically focused on some business engagement practices. So we'll be sharing more information as we get that implemented and going. But we have an excited group of community providers, the Behavioral Health Region, the Workforce Center, community college, vocational rehabilitation staff, multiple partners coming to the table with our managed care organizations to help look at systemically how do we work together to move employment forward in that region. And hopefully we identify some things that we'll be able to share across the board. So as we talk about competitive employment, one of the things I think we all could agree on, it starts with good benefits planning and good foundation to help look at how we help the individuals we work with do sound planning and to be able to move forward. And we have two great resources today. So with that, I'm going to turn it over to Mistie and Brian. Thanks for joining us.
Thanks, Dave. We appreciate you guys having us today. I think as we get rolling, we're going to have Brian start, and then I'll jump back in a few slides from now. So go ahead and take it away, Brian.
Okay, thanks a lot. Thanks again to Dave and Jess for having us in, and thanks to everyone that is on the line. So we're going to kind of go ahead and get into the meat of the training, which is return to work and how that affects individuals who receive disability and or SSI benefits. I personally like to look at benefits planning as a way to have more money and hopefully fewer problems. Like it or not, money kind of makes our world go round. So I'm going to cover some of this. This will be a brief overview. It's hard to kind of cover everything in an hour. And when I talk about benefits planning, I like to say Social Security has a really big butt. And I say that because oftentimes with Social Security, especially with benefits planning, there may be an odd rule here or there. So towards the end of the presentation, we have lots of individuals you can contact to get some quality benefits planning, whether they are associated with the WIPA project or the DEI project. But we'll definitely kind of cover the broad strokes and a lot of the general questions. So we'll start off kind of with a pop quiz or a poll. Hopefully this will be kind of fun, but some true faults when it comes to benefits planning. So we've got a series of true-false questions. We're going to do a poll. But up first, our questions related to on disability. These are all, again, true or false. On disability, I can only have $2,000 in the bank. If I make more than $1,000, Will I lose my disability benefits? If I have more than a dollar in, I have to keep at least $1 in Medicaid and $1 in SSI to keep my Medicaid. There we go. Now the slides are moving. I have to report my tax return and Social Security. The rules for SSI and disability are the same. And finally, there's one more. If I lose my disability or SSI, I have to do a new application. So we're going to do a quick poll for the folks that are on the line to see how many people think each of those is true versus false. So first, if people want to go ahead and do a quick vote, the question is on disability, I can only have $2,000 in the bank. Next up, if I make more than $1,000, I'll lose my disability benefits.
Got it on here, the meeting on here.
We have the one that says I have to keep $1 of SSI to keep my Medicaid. I have to report my tax refund to the Social Security Administration. The rules for SSI and disability are the same. And then finally, if I lose my benefits, whether it's disability or SSI, I'd have to do a new application. Okay. So as we're looking through this, looks like most people have voted. Looks like, let's just go through, and for each one of those questions, except for the last one, each one of those questions, the answer is false. On the very last question, if I lose my benefits, whether it's disability or SSI, I have to do a new application. The answer, truthfully, is it depends, but more often than not, the answer for that is also false. So throughout the presentation, we're kind of going to cover those and help you understand kind of why each of those is different. Okay. So what we have next is kind of the big question when people are looking at their benefits. And when people are talking about their benefits, they're really caring about two things. First off, their cash payments, the money they get from Social Security, whether that's disability or SSI, and some folks get both. And the next question is what's going to happen to my health care, especially the services that might be paid to my insurance. So Medicare and especially Medicaid here in the state. So we're going to cover some of those things for you. One of the big things, and I know this may sound counterintuitive or maybe not, depending if you worked with Social Security before, but if you have a question about disability or SSI and how work, earned income, affects those benefits, do not call the Social Security Administration first. The reason for that is that when you call the Social Security Administration, those folks deal with lots of different programs. Lots of different programs administered by the Social Security Administration, and the most common questions that they get are related to Social Security retirement benefits. So typically, if you're working in support of an individual that received either disability and or SSI, you really want to start with a benefits planner, because certified benefits planners really only deal with the disability and SSI benefits. So start with them. You definitely will most likely have to bring in Social Security, talk to Social Security, report things to Social Security, but you definitely want to start with the benefits planner. So when you look at Social Security, they really administer two programs to the folks that we serve. One is Social Security Disability Benefits, SSDI, and one is Supplemental Security Income, SSI. And there are definitely folks in the community that receive both disability and SSI benefits, and we call those folks concurrent beneficiaries. Here's a quick overview of some of the similarities and differences between the programs. Primarily, it depends on why. That's really an entitled program based on having an insured status. So that means the person that you're serving, yourself, or someone that's connected to that individual has worked and paid enough quarters into the system to earn their Social Security disability benefits back. A little difference there, we can go back a slide. Some things that come with that are if you're on disability, get Medicare. The amount of the benefit varies based on the earnings that an individual has. So the example I like to give is someone worked in fast food. and someone was an attorney and both get on disability, you would assume the attorney is going to get more in disability benefits, just given generally what the income is. Folks that receive disability typically get that money on the third of the month, and it's impacted by wages versus the SSI program. That's what's called Title 16. That is a income-based program based on various eligibility. That comes automatically with Title 19 in Iowa, at least. It has a set benefit amount, which Mistie will talk more about, and then that money is received on the first of the month. And what most of us, if you ever dealt with SSI, know, most income impacts SSI. So that being said, I'm going to let Mistie take you through some of the things that matter when money impacts those benefits.
Thanks, Brian. So kind of like Brian alluded to, the SSDI program and the SSI program are two totally separate entities within the Social Security Administration as far as disability is concerned, benefit. So how income affects those are quite a bit different. And of course, we all know that we want the beneficiaries who are working to report that earnings to the Social Security Administration. And just to kind of cover a little bit about what that looks like for either side of those programs, for SSDI, we're talking only earned income. So gross earnings from wage employment or net earnings from self-employment. And it had changed a little bit recently for the SSDI side of things. They used to look at those earnings when you actually worked those hours or provided the service, and it's changed a bit, and now it more relates to the SSI kind of philosophy that they look at the earnings when the person actually receives that check. So that might be something new for the folks on the call. That has just changed in the last few months. Whereas the SSI has stayed the same, and that looks at most income, both earned and unearned. And some of those can include things not only from gross earnings from wage employment or net earnings from self-employment, but that includes SIP benefit or gifts above $20, gambling and lottery winnings. A spouse's wage for sure has impact on SSI benefits. And that doesn't include any SNAP benefits or Section 8 assistance or public housing assistance. And we do get that question a lot, if that is included in what they look at for total income, and it's not. So let's talk for a second about money in SSDI. So as we said, SSDI is kind of an all or nothing program, and that's only impacted by earned income. So really, even somebody who has as much money as Bill Gates, if they acquire a disability or an impairment, may be eligible for SSDI benefit. And again, then they start to look at that earned income, that what would impact that benefit. Social Security only counts gross wages, so before taxes for the wage employment, and then they look at the net wages or after the taxes and expenses for self-employment. And there's a calculation that goes along with that. If you're working with somebody with self-employment, it gets a little more complex. But we want to think about all earned income really needs to be reported to Social Security. And the best advice to give to the folks that we're working with is to do that on a monthly basis. It's for nothing else to keep their record current and up to date, because you may have experience working with Social Security that isn't sometimes not the case. So we just encourage folks to do that on a monthly basis. And a little bit, I wanted to touch on the amounts for this year, 2017. That has went up a little bit as far as substantial gainful activity amounts. So what is that magic number, I guess we want to call it, for folks that can work up to and still pair their benefits with earnings? That's $1,170 for someone who's not blind, or $1,950 for those folks who are blind or staff blind. Also, the one important thing for somebody who's married is that their spouse's wages do not impact SSDI side of the program. SSI, yes, but SSDI, no. And same thing goes for resources or assets. There is no cap on that. They do not have an impact like SSI does. And of course, tax returns are not counted for either of the programs. Being that this is the prime time for tax refunds to come in, that's a question we get quite frequently. So I know you're all excited to do a little math on Valentine's Day, so here's some for you. I just wanted to run through a basic SSI calculation with earned income. And this gives you an overview of that, where the earned income, we're using $885 for today's purposes. And of course, there's always that general exclusion of $20 for somebody who's working. So they're going to subtract that amount right off the top. And as you can see, that leaves us with the $865. And then being that they're working, they get the earned income exclusion as well. So that leaves us with the $800, which of course is divided by half. And really that is what counts as accountable earnings. And this is the calculation done without any work incentives applied or anything like that. So this was just very basic for our overview today. And then I wanted to show you guys what it looks like when they total out the reduction of that SSI payment and the total gross income that they end up with. We need to tell the folks that we're working with that you're always going to be ahead by working. And that shows that $735 is the full benefit rate for 2017 on SSI. They minus out those countable earnings, which, like we said, is less than half, the $400, which makes that person's new SSI payment $335. Excuse me. So you add that in with the gross income, and that person's coming out with a total gross income of $1,220 a month. Way more financially in the positive than just having an SSI check. And we also want to make sure we note for the folks that we're working with that there's a 2-month lag time on the SSI side of things. So if somebody is working this month in February, it's not going to affect their March check. It's more than likely going to affect their April check or possibly even the May check if it doesn't get onto their record in a timely fashion. And then, as we noted with a little asterisk on this slide, we just kind of want to give a magic number, we like to call it, of about $1,555 is the amount somebody can earn per month for most folks before their SSI check goes to zero cash benefit. So let's talk a little bit about what happens if someone's earnings are so high that their SSDI or SSI stops. And there's a couple of different things to this. First, let's chat about the SSDI side. There are multiple phases for SSDI that somebody who is just getting back into the work world will go through. And that is all going to happen before their benefits are terminated. And really, it's about 3 years and 9 months before that would even happen. And that includes any impact on their Medicare as well. Whereas SSI, there has to go through 12 months of consecutive no cash benefit before that's actually terminated. We want to give you some 2017 numbers about for the Medicaid threshold for this year, and that also leads into a work incentive called 1619B, which we'll touch on a little bit. And it's more related to the SSI side of things, and that number is $37,642 for this year. And that's the threshold that a person can make before not income eligible for Medicaid. And of course, both of these benefits have the safety net of about 60 months or 5 years before they could tap into another work incentive called expedited reinstatement, where benefits can be restarted without filing a new application. Ideally, that claims rep in the Social Security office is going to sit down with that beneficiary and weigh it out for them. Which way is going to work better? If filing a new application, like let's say, for example, somebody had a new impairment that has come up since they've been working, that would constitute a new application. The expedited reinstatement has to relate back to their original disability that they came on the rolls for in the first place. So that claims rep, in a perfect world, is looking at both scenarios for that beneficiary to see which one is going to work better for them. And of course, we always encourage a beneficiary to talk to a benefits planner to really delve into more of these details. Again, like Brian mentioned, we're giving you an overview today, so if you have questions, let us know. And I think we're going to cover some of those more at the end of the session today as well. And just a couple of reminders to think about. Everyone can work. We are talking to transition students as young as 14 years old that, you know, starting work should be the expectation, even in high school, so that you're building up those work credits and you have something to fall back on if you need to down the road. You can definitely work and maintain benefits. I think there's still a huge myth out there that you start to work and you just automatically lose your benefits. And we know that's not the case. And that's what we're here to help people figure out, is how that can work for every person in their own individual scenario. And along with that, folks need to understand that you can gradually transition off a benefit. It's not going to happen overnight that you're just one day going to wake up and not get your check anymore. So that's really important for beneficiaries to understand. And I think one of the biggest questions that we see in the WIPA project is, what happens to my health insurance? With all the changes that Iowa specifically has been seeing lately, we want to make sure and reassure the folks that we're working with that there's ways to safeguard Medicare and Medicaid, or even if you have to pay in or buy in to keep that going, that there's options for that. And again, we really want to highlight that we always want to report wages to Social Security and ask for a receipt. So even if somebody is calling on the phone with their SSI to report those wages in, it's a good idea to ask for a receipt of that or have something sent to them. So that way down the road, if they get a scary Social Security letter that says they're now in an overpayment, they have some backup to say that they did, in fact, report their earnings and should be on their record. And of course, if we're talking medical review protections, then we want to be talking with folks about assigning their ticket to work to an employment network. So let's revisit a little bit the poll. Brian kind of covered this, but let's see if we've already covered all these questions.
So we're going to talk about each one of these in some detail, and you can see the answer we're flying through, just to kind of show you why each one of those was false and just kind of explain a little bit. So first off, on disability, I can only have $2,000 in the bank. That is not a disability rule. That is an SSI rule. Now, as a benefits planner myself, I see this happen all the time. SSI, SSDI, those are really easy things to get confused. Many people call both programs disability. And a lot of times people worry about the resource guideline when it comes to DHS Medicaid type rules. But when it comes to getting disability, so a person can start check on the 3rd or a certain Wednesday, there is no resource limit. They can have as much money in the bank as they want to. They can own as much property, have as much assets as they want. This is a rule that applies to SSI, and it can be raised through MEPD, which is another reason for the folks that we serve to look at getting employment. If a person is on SSI and they go to work, they qualify for a program called MEPD, Medicaid for Employed Persons with a Disability. The primary benefit of that is that it raises the resource limit from $2,000, which is common across the state of Iowa, to $12,000, which means the folks we serve can save more money, can put things away, and again make themselves much more self-sufficient. If I make more than $1,000, I'll lose my disability benefits. That is referring to substantial gainful activity, that limit that you heard me and Misty refer to earlier. That number goes up. It hasn't been $1,000 for quite a few years now, but I think because $1,000 is a round number, people tend to remember that. The SGA changes typically every January. For 2017, if blindness is not your primary disability, 1170, which is gross, is the SGA. And if you're blind, 1950 is the substantial gainful activity, the limit before something may happen to your benefits. And I always like to stress the word may, because there's lots of work incentives that we really get into too much during this just for time, but there are several ways that individuals can make much more money than either of those amounts and still keep their benefits. I have to keep $1 of SSI to keep Medicaid. Absolutely not. That is based on, and in fact, I did not update this slide. I apologize, but it is now a little over $37,000 per year. That's the Medicaid threshold. I will make sure that gets fixed, as well as you do not have to report your tax returns to the Social Security Administration. The reason why is that if a person is on disability, earned income is not reportable, and your tax return is considered unearned income. Just like if you're serving someone that's on disability, and let's say they were getting unemployment benefits, that is also unearned income. Does not have to be reported. SSI has already counted that money when they were adjusting the person's income. So when a person's working, if a person's working today, and they report that they're working, fill in the blank employer, and that affects their SSI check, that money's already been counted. If you report their tax refund, you'll be asking Social Security to count the same money again. So neither benefit, whether disability or SSI, does a person have to report their tax return. SSI and disability, the rules are not the same. If that was the one that we had 100% of the people on the line all say that is absolutely false, the rules are definitely not the same. I put a little sarcastic duh there. And if I'm losing my benefits, I have to do a new application. You do not have to do it. If a person loses their benefits because they're working, so they get a letter from Social Security and says that Jack or Jill is losing their benefits because of their earned income, because of their work, every person gets a 5-year window called expedited reinstatement period. EXR is the shorthand for that. During that time frame, if they need their benefits back, they pretty much just have to meet this standard. First off, they need to be within the 5 years, the 60 months. Secondly, they need to still have the same disability or related to whatever they initially won their benefits on. So if a person is drawing benefits on, let's say, a mental health concern, is that mental health concern still there? And then thirdly, their current income has got to be low enough that they qualify for a benefit. So if I'm on SSDI and I work long enough that Social Security terminates me from my check, and a year later I lose my job, or my income goes way down from working, as long as within those 5 years I still have my same disability, and my income, again, is under the SGA amount, I can go into Social Security, ask for my benefits back. There's a very small amount of paperwork that I do, which primarily releases of information to verify the medical side of this, and two things will happen. I will get 6 months of what are called provisional benefits, temporary benefits, while Social Security does a medical review just to make sure I still have my medical disability, and once, if that review verifies that I still have my medical disability, my benefits come back like normal. If I was on the SSI program, the same rules apply, and then once they give me my provisional benefits, as long as they can verify medically that I still have that disability, my SSI benefits will restart. Worst case scenario, if a person moves to the point that their benefits are terminated and they go through the reinstatement period process, even if Social Security views they do not meet the medical standard anymore, which is usually not the case, by the way, but even if that happens, the 6 months of temporary provisional benefits that they get, they do not have to pay back. So if you're working in support of someone and they've moved to that point, please, please, please make sure to convey to them there's a huge safety net for individuals who move to the point that their benefits get terminated. Believe it or not, the Social Security Administration actually wants people to try working and to be successful.
Absolutely. So a little
Okay.
bit, we want to, here you go, Brian. Are you going to go with this one?
I can do it or you can, whichever one.
I can jump in.
Go right ahead.
So a little bit, we wanted to show you a comparison, SSI versus the SSDI. We've kind of covered most of this, but just to kind of put that in as solid, on the SSI side of things, as Brian mentioned earlier, that check comes for most folks on the 1st, or gets deposited. And with SSDI, it's on the 3rd. So this is kind of a leading question you can ask somebody who you're working with to find out which benefit they receive. Because sometimes folks that we work with don't really know which one or if both they receive. So this is one of those telltale signs where you can find that out. Secondly, for SSI, again, there's a set amount, the $735 for this year for an individual, or $1,103 is the couple. And then on the SSDI side, like Brian alluded to, it depends on your previous earnings, how much you were making in that time frame when you were applied for benefits as to what your amount is. Not very many people have the exact same amount on that. And you can also tell if somebody's telling you that they make $1,100 on their benefits and they get the check on the 3rd, it's pretty safe to say that they receive just SSDI benefits and not SSI benefits. And then as far as health insurance, Medicaid comes with SSI, Medicare with SSDI. If somebody's receiving both of those benefits, they can very easily have both health insurance. And again, as far as income is concerned, the SSI side of things, that check is going to be reduced depending on what that earned income is going to be for that individual. Whereas SSDI, that check is all or nothing depending on how much income they're making, whether or not it's over SGA or under. And then back to the SSI side, that check is impacted by most income, earned and unearned. A lot of folks think that if they get unemployment benefits, that's not going to affect their SSI, but it definitely is. And then again on SSDI, it's only the wages that impact that check at all. On the SSI side, the resource limit, like we had mentioned, is the $2,000 for an individual or $3,000 for an eligible couple. And DI side of things has no resource limit. So just another revisit here about the new amounts for 2017. This is kind of your numbers to know. And Jessica can send this out to everyone if they want this PowerPoint after the session is over as well, so you have this information. But just to run down the numbers, there was a cost of living raise this year. So we see the substantial gainful activity amount for non-blind individuals at $1,170. Blind individuals, $1,950. So again, that's the amount somebody can work up to without applying any work incentives before it starts to affect their check at all. And then we also listed for you the triggered amount that will let Social Security know that that individual is working at trial work level, and that's $840. For the SSI numbers, again, the individual is $735, and the couple is $1,103. And like Brian mentioned, these change every year, and we try to make sure that we're getting this information out to you in the first couple months of the year so that you have it. You can always ask us if you need it. We wanted to chat a little bit about both services that Brian is able to provide underneath the DEI and his benefits planner crew, as well as an overview of what WIPA services are. There's a team of 2 of us. Tammy Crouch covers the western side of the state out of Sioux City, Iowa. And I'm based out of Mason City area and cover the eastern side of the state. And we both share Polk County. And as many of you know, WIPA is the Work Incentive Planning and Assistance project that's funded directly from the Social Security Administration. And we provide the work incentives to the beneficiaries who receive the SSDI and or SSI benefits who are pursuing gainful employment or self-employment. And we work through Disability Rights Iowa and are certified as community work incentive coordinators underneath the Social Security grant. And I just wanted to touch a little bit about our service model because there's been a change in that within the last couple of years for WIPA, and we have really always had these same priorities. We're just kind of drilling them in a little more so that we can make effective time management for the folks who are in these two priority groups who really need the information as quickly as possible at those critical touch points. And what happens with these priorities for the WIPA folks that we work with is it allows those individuals to, again, get that most crucial information for their professional development while they hopefully are being proactive and avoiding any possible issues that might come up as they're transitioning from being on benefits to working and have that earnings income. And just to touch on those priority groups, the folks that we're going to visit with first are going to be those beneficiaries who are currently working or engaging in self-employment, and they both have a need and an interest in receiving individualized work incentive planning and assistance. And that really means if somebody's working or maybe can get a raise at their job or they're working self-employment and they have benefits questions like involving how do you figure net earnings from self-employment or maybe a past plan or more intensive services, those folks are the ones that we're going to be connecting with first out of our referrals that we're getting in. And that second priority group that's listed on the slide are also doing employment or self-employment, and they're interested in receiving the counseling, but maybe they just aren't working yet. Maybe they have an open case file with an agency, and those kind of fall into that second priority group. And just to kind of clarify for everyone on the call that the referral process for WIPA has changed over the last few years for simply being able to streamline our services and be able to, again, get those beneficiaries the information they need at those critical touch points. So what we're hoping that everybody is doing is calling the Ticket to Work helpline, and the numbers listed here on the slide. And the way that that works for us is when an individual calls the Ticket to Work helpline, they will not only be able to answer basic benefits questions like what's SGA or how much can I work, but they are our triage process. So they do intake and referral for us. They determine whether or not that person is even eligible for WIPA services or has a need right then to get that. And a couple of the questions, are you receiving benefits? Are you working? Are you actively preparing for work? And then the Ticket to Work helpline call center counselors get those folks to us through our data system. And they are sending us the high priority folks who need those benefits planning individualized services at the critical moment. So they are a huge asset for all of you on the call to be calling the Ticket to Work helpline to get those folks to us. And again, there's just 2 of us in the state, so I wanted to share with you a map of what our coverage area looks like. On the eastern side of the state is colored kind of in a pinkish color on this slide, and those are my coverage areas. And then on the western side of the state, kind of in an orangish color, is Tammy's coverage area. And because of pure volume, we share Polk County. So if somebody comes through the Ticket to Work helpline and lives in either of our counties, they come directly to me, and then I separate them out as the coverage areas between Tammy and myself. And it's just to let you know that we are required to turn those around within 5 working days. So when we say we're getting them the information in a timely manner, that's exactly what we're doing. And the best way to do that is to have your folks call the Ticket to Work helpline, and then they'll get them to us. But we also wanted to share our contact information so that if there was other questions that you had or resources that you needed to tap into, that's provided here for you as well. I'm going to turn it back over to Brian, and he can tell you a little bit more about what the DRCs have going through the Disability Initiative.
Sure. Thanks, Misty. So as Misty stated, she works with the WIPA program, and I work through what is called the Disability Employment Initiative. Most folks call it DEI. And what that is an initiative piloted through the Department of Labor that's meant to help persons with disabilities move to employment. And a big part of that is benefits planning. So unfortunately, the DEI grant is not in all of the state of Iowa yet. Currently, we serve 5 regions. So on the slide that you see before you lists out the 5 DRCs and the areas that they cover. So Workforce works as a regional system. So even though there's 5 regions, there's several counties within those 5 regions. So we have a person based out of Spencer, a person based out of Waterloo. Region 11 is based out of Des Moines. Region 12 is based out of Sioux City, and Region 16 is based out of Burlington. So just to repeat that, 3 and 4 are based out of Spencer. Region 7 is based out of Waterloo. Region 11 is based out of Des Moines. Region 12 is based out of Sioux City, and Region 16 is based out of Burlington. Feel free to contact any of those 5 individuals if the county that you serve is covered, as well as I am also in the Des Moines area. If you have questions about trying to connect with different types of assistance through the workforce centers when it comes to career planning and benefits planning through any of the workforce offices, feel free to contact either myself or Sheila Stokel, our info benefits planner. So again, if you feel you have a question either for yourself or person that you're serving, the organization, feel free to contact us. And if you'd like a lengthier presentation, not that an hour, I'm sure you guys are dying for more info on benefits planning, but if you wanted to expose your organization, your staff, the person that you serve to maybe a little more in depth when it comes to benefits planning, we definitely can also do go out and do presentations and trainings at organizations. Again, it's not going to make you a certified benefits planner by any stretch, but it will cover, again, some of the stuff we've talked about today and maybe get into a little more detail if you would like that. So feel free to contact myself, Sheila, or any of the DRCs if that's something that your organizations will be interested in. So with that, we have about 17 minutes by my clock to cover question and answer. We want to make sure we left plenty of time for you guys to answer and to ask any questions. So feel free to ask us anything you would like to know.
I see that there's one question in the chat box already. Somebody had asked if we don't get receipts, what do we take? And I really think having a good communication with your local Social Security office is your best way to go. And if you don't know who that person is in the office, please reach out to one of us and we can give you some contact information for the local Social Security office. It's always better to ask for the receipt so that you have a little backup. So the folks you're working with, they have that going forward.
I know that oftentimes with the folks that I'm working with, they many times do report their wages via fax, and what I have is a fax template that I give to customers that I'm working with on when they're reporting their wages, how to request that receipt from the Social Security Administration to verify that they did actually receive their wages. So what I can do is I can also share that with Jessica, and I'm sure I think she would be nice enough to send it out to the group.
Absolutely.
Hey, Brian, this is Dave, and back to that question. It was kind of insinuating that if the person's below SGA,
yeah,
and they have some, repeat what they should be doing.
Sure. So a couple things. So let's talk about the SGA amount, then if you get some pushback from the Social Security Administration. Even if a person is not earning SGA, they still should be reporting their wages. Here's why. Whenever a person first goes back to work after getting on their benefits, this is for SSDI, they have what's called a trial work period, where no matter how much money that an individual makes, their benefits are not affected. Let's say someone's making significant money. They're making $2,000 a month. If they're in what's called a trial work period, they can make that $2,000 a month and still get the disability benefits. The SGA number becomes relevant once a person has used their trial work period. If a person's not reporting their wages, Social Security has no way of knowing that they've used their trial work period. So anytime that they're working, they should really report their wages. That's where that 840 trial work number period, trial work period number comes into play. But regardless of that, whether they're making 840, which starts trial work period, or any other number, my suggestion is for individuals or for folks supporting individuals, always report your wages because it's just a good skill to learn. As individuals are becoming more self-sufficient, they need to get in the habit of reporting their wages. Those treated very well may say, and I've had this experience myself, well, you only made a couple $100, you don't need to report that. The problem with that is that the numbers are variable. Now, my time doing this, the numbers have never gone down. They've always gone up or stayed the same. But if individuals get used to hearing, I don't have to report this, I don't have to report that, they may forget to report something when they need to report it. So it's really good just to get in the habit of always reporting. Now, if you report something to Social Security, they have to do something with it. And I understand that we are all overworked and they serve millions of customers. However, it is always a good idea, no matter what the income amount is, to report to Social Security, plus you give yourself this safety net. I reported it, now it's kind of on them to apply the wages in the proper fashion.
I would also back you up on that, Brian, and just say if they're getting pushback from their local office when they're trying to report and have not reached trial work amount, let that Social Security office know that they want to keep their record current and up to date. Because if down the road they start working and it's over SGA, they're not going to be able to track if they've used trial work months or not, haven't reported the earnings. Social Security doesn't even know you're working unless you tell them. So it's always a good idea for folks to report their earnings, no matter if it's $200 or $2,000 a month. What other questions do we have?
We had a question. We had a question come in about general benefits planning. I think our topics today focus specifically on individuals who are in SSI or SSDI. But if somebody had just general questions, is there a resource for them any place?
Well, you could start with the Ticket to Work helpline, and they could definitely give you some resources. For the WIPA eligibility criteria, you have to be receiving SSDI or SSI benefits to receive those services. But for general questions, I'd suggest Ticket to Work helpline, and they could kind of give you some resources on where to go next.
Along with that, I will say one of the things that fall under the DEI grant requirements is while primarily benefits planning from the idea of Social Security disability and SSI benefits. However, there is the idea of other income-related services, so whether that's food assistance, housing assistance is a big one for a lot of individuals, health care. So in the regions where there are DRCs, you can definitely reach out to those folks. So even if they may not know the specific answer, those DRCs are required to be connected with other income-related services such as DHS, such as Section 8, such as public housing, food assistance, well, that's under DHS, child care, things of that nature. So if you have a question about a DHS/HUD, even things like energy assistance question and how these wages may impact that, if you're in a region where there is a DRC, you can definitely contact those individuals and ask the question. They may know right off the hand. If not, they may have to do some research. But again, those overall other income-related services is part of the benefits planning that the DRCs should be doing. So please make sure to use those resources in the community as well.
Anybody else have questions?
We were great, apparently.
Apparently. And it sounds like just kind of reading through this chat box that Jessica is going to be sending out the slide presentation to those folks who are not on the emailing list. It looked like she had her email in there. Jess, if you could put that back in so people can get it if they didn't catch it the first time.
Absolutely. Yeah, thanks for bringing that up. I think I'll add it to the chat box as well in the next, here, I'll just bring up our closing window. David, do you have anything else?
No, thank you very much, Misty and Brian. This has been a very popular segment. We had over 100 registered guests. I'm sure many more than that were participating in multiple groups. So I think this might have been one of our record setters. So thank you for sharing a little bit of your knowledge and expertise. And I think, as people have indicated, the PowerPoint will be very helpful, and people will be able to use this as a resource as we go forward. So thank you. Jess, I'll turn it over to you.
Thank you, David. Thanks again, Misty and Brian. I want to draw everybody's attention to the lower left-hand corner. That's where you can download the PowerPoint presentation straight from the window here, along with the 2017 schedule. We'll be back next month in March, but that's kind of one of those days that falls out of sync. We'll be back March 16th. It's a Thursday from 1 to 2 p.m. Central Standard Time with subject matter expert Abby Cooper, who will talk to us about negotiation and taking discovery all the way to the job offer. We're excited to have Abby back again. Please share your feedback about the webinar in the poll questions. And again, I wanted to draw your attention to the benefits training flyer and registration for the Sioux City training coming up. Misty, do you want to share a couple details about that real quick?
I would, thanks, Jess.
Yeah, sorry about that. Go on.
Oh, gosh, no problem at all. And it's actually Disability Rights Iowa is starting the training unit, we'll call, because we have heard from folks across the state that they could use more information about benefits planning and really would benefit from hearing a little more in-depth in the training piece of that. So we have started our first session is going to be over in Sioux City at the Iowa Works office March 8th from 10 to 4. It's a lunch on your own. And you're going to be walking away with some really valuable information, and it's going to be an interactive training, and we would love to see you folks there. And there's not only the flyer is included here, as well as the registration piece. It's $100 per person. If your agency feels like you get a better benefit of having something like that at your own agency, that's something we can arrange at Disability Rights Iowa as well. And this is going to really go into more in-depth on work incentives, calculations, give you a much broader scope than we were able to cover today.
Perfect.
And if you have questions about that, feel free to reach out to Tammy or myself.
And again, I'll be sure to send it out as an attachment along with everything else to the mailing list here, hopefully before the week is over. Again, just send me your email addresses along with your name to that pruittjess@gmail.com, and I'll be sure that you're on the mailing list, and that means you will receive all information going forward, including invitations to future webinars and all the materials that are disseminated afterwards. Thanks again, and have a very happy Valentine's Day. See you in March. Bye-bye.